I am Lieutenant Cameron Brassfield, and in conjunction with Lieutenant James Park and Lieutenant Commander Paul Maldonado, we present Treponema Down Memory Lane, the Value of Risk-Informed Diagnostics. Some background. Syphilis infections have seen a rise in the past few years with common symptoms such as ulcers and rashes. It is well known that it can also affect multiple organ systems, but rarely does it present with an intra-abdominal mass. Presented is one such case. We had a 27-year-old male who presented to the ER with persistent pruritus, a rash, 5 days of worsening right upper quadrant pain, and a normal ultrasound 5 days before in the ER. He had a social history that included receptive anal intercourse, which is important when considering the value of risk-informed diagnostics. He had significant right upper quadrant pain on palpation, acneiform and macular rash on his forearms and chest that spared his hands and feet, and no lymphadenopathy or chancre. His initial lab showed an AST-ALT elevation as well as a CRP elevation. His D-Billy had increased from 1.7 to 5.1 over a 2-day period, and after a negative right upper quadrant ultrasound repeat, we got an MRCP that showed a 7 centimeter periportal mass encasing the portal vein and inflammatory changes in his prostate, liver, and colon, which was concerning for a lymphoma. We transferred him to our sister facility for biopsy of his mass. Soon after transfer, we received the results of his syphilis titer, which was greater than 1 in 32. Reports of the biopsy were negative for spirochetes, but the mass started receding with bicillin dosed for secondary syphilis. On reviews of his imaging in 22 August, we see a significant decrease in size. There's only one similar case of concomitant syphilitic hepatitis, colitis, and proctitis in the literature. Syphilitic hepatitis itself is uncommon, but clinically symptomatic patients are rarer, and hepatitis from a periportal lymphadenopathic obstruction from syphilis is not known to be demonstrated in the literature. Some conclusion takeaways. Syphilis is a common STD that can be included in diverse differentials. The biopsy of this lesion could have missed the syphilitic infection if not originally considered. Disease-defining characteristics cannot always be relied upon for diagnosis, such as rash-sparing hands and feet, and such as the swelling in his abdomen that looked like a lymphoma. Routine history taking was what allowed for a robust differential as well as a more targeted, risk-informed diagnostic. This is what allowed our patient to be diagnosed with syphilis and be treated. Thank you for your time.